We've pushed really hard this year. We've had a great year of stabilizing our finances. We've really focused a lot on facility improvement this year. If you go down to Eufaula, you see the old clinic has been painted and rejuvenated. We've got steel coming up out of the ground with a new facility, so we're about 18 months from having a brand new 70,000 square foot new facility in Eufaula. The Okemah Hospital is much cleaner today. If you go in, the floors all look really clean. The kitchens are all really clean. The financial status is stabilizing there. We just passed our state inspection over at the rehab hospital, so we're really excited about that. We've got of course, this new facility happening in Okemah that we're going to have open by the end of the year. So extremely excited there. Potentially hundreds between the two facilities. Very quickly, we're going to have to start thinking about additional housekeepers and caretakers and ancillary staff here at Okemah. We probably won't grow as fast here. It'll be kind of a staging process as we grow into the building, but just the size of the campus is going to require a lot of extra housekeepers and caretakers. The Eufaula Clinic, we will start next year, and it'll be significant hiring there. Well, we're really focused on trying to improve access. We want patients to be able to get in and to get care quickly. And so just the operational efficiency of that, simple things like answering the phones and the new phone systems that we're bringing in, the quality of care. We're talking to some really good doctors that we hope to bring on board into the medical staff. And so we're excited. And we've got a lot of ideas about expanding hours into after hours or weekends that we might be trying to pilot some just to see if we can't expand care a little bit. Well, we want them to be engaged. We've really been out in the communities promoting our Together We Can Do More campaign. And this is not just about our operation. This is about everybody in the Muscogee Nation be involved to make their health system better. So whether it is enrolling in Medicare or Medicaid and letting us help them get enrolled in the insurance plan, communication back to us on how they're doing. It takes everyone's effort to make the system better, and so we want our citizens to be engaged in helping us do that. The reality is that Indian Health is not an entitlement program in the federal budget like the VA or Medicare. It's a discretionary spending. So if you ever watch the TV and you see a politician say, we're going to cut discretionary spending by 10%, Indian Health Service goes into that bucket of spending. So it's always vulnerable. So by law, by federal law, we are required to bill Medicare and Medicaid and private insurance to supplement our budget. So not only is it not detrimental, it's imperative that we do better, because I don't see the government ever doing more to try to build our health care. It's going to take the tribe to solve its own problems, and that's how we're going to do it.
The National Council action in April was to extend the loan at no cost to the nation. So there's no fees, no additional money we had to loan. We're under budget. But the time of the loan would have ended in June 30th. And so the bank allowed us to do a 6-month no-cost extension just so that we could get everything opened. And so council passed it on Saturday. I signed it on Saturday, and so this week they're finishing the paperwork on that. Well, the hospital construction is pretty much online in terms of our schedule. The road is out nearby. You know, we recently we encountered a lot of right-of-way issues we had to deal with, so that set us back more than anything else. And so to make sure that the hospital opens on time and that the road gets finished, we needed to extend that contract. During our administration, and with my background in healthcare, one of the first things we wanted to look at was this facility here. There were opportunities, and there are opportunities to re-engineer things to save cost and to improve quality. And so we've been able to do that. If you look at some of the lighting, we changed the lighting so that we use lower power but brighter lights. We re-engineered some of the outside appearances to either add glass or take some glass away because it would bring in heat, so it would cost us more to cool. And so we just kind of fine-tuned things the way we felt that we needed to. There were some issues of placement, so we modified the floor plan to accommodate better efficiency, and then basically turned that over to the contractors. We did change the prime contractor. Manhattan's now the prime here, and we felt we needed to do that for just their experience and their ability to manage multiple subcontractors. And it's worked out well. You know, we're on time, we're on budget, and we're almost through. So what you've seen today is we're probably about the 95th percentile in terms of completion. A number of the people who were laid off in September have already been reemployed. Some of the people that we kept left, so we used some of those people to come back. The exact number I don't know. We'll continue to do that, and because those people, the staff that we lost, those individuals are valuable to us. So if we can work them in, we will work them in, and we'll continue to do that here. You follow whatever is available. Well, now that we have, you know, the Secretary of Health in place, the monthly operational reports is going to be vital. So that will look at not only the financial side, but also the quality side, workload side, and we need to look at that frequently to gauge what needs to be moved. Where in terms of a tribal healthcare system, we're a fairly large healthcare system. 2 hospitals, you know, 9 outpatient clinics. We got a lot of moving parts for our citizens. So we just want to make sure things are coordinated, they're done efficiently, make sure that we guarantee the quality, and that takes continuous review. And so we've got that in place, and I think that what we will do is just continue to fine-tune that as we go along. That hopefully they already see that it's being responsive. With the technological advances that we have as well, they should see much more ease in getting appointments, shorter times waiting when they arrive at the facility, better technology and diagnostics. And what I want them to see is that translates into being seen quicker, getting good care, and then being able to go back home, because that means a lot to them. They like the place, but they don't want to spend the whole day here. And we don't want them either, because we don't want them to catch anything from any other patient. So we will come in, have them come in, treat them, and let them go home. And I think we'll see a lot of improvement. We check a lot of factors regarding, reinfection rates or infection rates, readmission rates to hospitals if they are discharged from here, just to make sure that we're doing things to keep them at home and keeping them healthy. Well, I think what the citizens, maybe they won't see, but the thing that I think is important is the fact that we're using geothermal, so we're using the Earth's own energy to heat and cool this facility. We're using a lot of lighting in a way that saves money, but also provides a view of the land. You see the design of you see the names of all the clans of the tribe, and to me, even the woodworking and the colors and all, I think it's going to be something that would put them at ease, make them feel comfortable coming to our facilities, and especially here in Okemah. And I think that will be well received by our citizens.